Fomentations have been proven to be an effective preemptive treatment for both viral and bacterial lower respiratory infections, as well as some more serious cases. In this demonstrational video, we will build heavily on previous videos as far as hydrotherapy concepts are concerned. But first, some history. Just over 100 years ago, the 1918-1919 influenza pandemic caused by the H1N1 virus was in full swing. This was the most severe pandemic in recent history. It is estimated that about 500 million people, or 1/3 of the world's population, became infected with the virus. The number of deaths was estimated to be at least 50 million worldwide, with about 675,000 of those occurring in the United States. It was a big deal. But here's what's interesting. An official report of the disease in Army hospitals states that 20% of the soldiers were infected with influenza, and 16% of those with influenza developed pneumonia, which was basically a death sentence at that time. 40% of those who developed pneumonia died, making the case fatality rate 6.4%. Compare that rate with the collective statistics of 10 sanitariums. Of those with influenza, 8% of the outpatients developed pneumonia, while 2% of the inpatients developed pneumonia. The case fatality rate for this group of outpatients was 3.8%, and the case fatality rate for the inpatient care was 1.3%. This is significant, especially when considering that the outpatient care was being done at home, primarily not by medical professionals. Consider also the report of an Adventist seminary in Hutchinson, Minnesota, which had a total of 180 students and teachers, 120 of those being housed under one roof. 90 individuals developed influenza, and not one of them died. Dr. Fred Shepard, who was the public health officer of Hutchinson City, confirmed this incredible reality to be true. So the treatment used in both of these situations, and many more, were fomentations to the chest. The purpose and rationale of this treatment is to raise total body temperature, which increases both the innate and adaptive immune system's capacity to combat pathogens. It also creates a thermal toxic environment for viruses and bacteria, and then localizes the effect to the chest and lungs. I think of this treatment as stimulating the immune system and heat shock proteins, creating an environment that is not very compatible for viruses and bacteria, and then bringing all the physiologic mechanisms stimulated to the lungs with the fomentation. A fomentation is a method of heating a specific area of the body. There are various types of fomentations or heating compresses that are designed to retain heat as long as possible. But for our purposes, we're going to keep it simple and use bath towels, rolled up, thoroughly soaked, and then wrung out. We want them wet so that it increases the heat capacity and heat conductivity. This allows the fomentation to hold and transfer more heat. So let's get started. Start the treatment by having the patient, client, or friend lay face up on top of a very warm fomentation that will run the length of his spine. This will help to heat up the lungs and the entire body. Then place the feet in a very warm basin of water. This will also help to increase body temperature and relieve core congestion. We will be adding more hot water to the basin as the treatment progresses. This large towel folded in half is our barrier towel. This towel will enable us to adjust the temperature by adding and subtracting layers as our patient indicates to us. I will use another bath towel to wrap the hot fomentation in, making it easier to work with and insulating the top of the fomentation so that less heat is lost through the top. The fomentation is in a plastic bag so that the moisture doesn't evaporate away as quickly during the heating process. Be careful handling the fomentation because they're very hot, as you can see by the steam. Then place the whole assembly squarely on the chest of the patient. The purpose of all this heat is to increase metabolism of both the innate and adaptive immune system. Remember from our physiologic response to hydrotherapy video, a 1 degree centigrade rise in body temperature requires a 10 to 12.5% increase in metabolic rate. By this time, the patient's feet have pretty well acclimated to the starting temperature of the water, so we will add some more hot water. Always communicate with your patient about the temperature. I'm taking water out so that I can add more hot water in. When adding the hot water, be sure to move the feet to one side of the basin and have your hand in between his feet and the hot water being poured in. It's not an absolute contraindication, but something to be hyper aware of and sensitive to are those with diabetes, peripheral neuropathy, or loss of feeling in the legs or feet, because they're at an increased risk of being burned, because they can't judge accurately when it's too hot. In this clip, the patient told me that it was getting a little too warm on his shoulders and upper arms. So I'm adjusting the heat by allowing some hot air to escape, wiping off the moisture from the skin with my hand. It is of utmost importance to keep the head cool throughout the treatment, especially towards the end as the temperature is increasing. You can achieve this by dipping a face cloth in ice water, then moderately wring it out and proceed to wipe the sweat from the patient's brow, cooling off the head. Another group where special care and treatment adaptation need to be made is those with circulatory diseases, such as peripheral vascular disease and arterial sclerosis of the lower extremities. Individuals with these conditions are less able to thermoregulate, and due to the intrinsic effect of heat increasing local cellular metabolism, without the vasculature able to respond adequately by bringing more nutrients and oxygen to the area, this can end in ischemia and cell death. At this point, the patient has had the fomentation on his chest for about 4 minutes, and I am explaining to him that I will be preparing the next fomentation. Always keep the patient informed of what you're doing, as this helps them to stay calm and relaxed while they are in this vulnerable position, and it also helps to keep you on track. The fomentation was in the microwave for about 3 to 4 minutes. I use the microwave as a timer, which helps me to stay on track and do the exchanges every 4 to 5 minutes. After preparing the fomentation, set up for the cold brisk friction and remove the previous fomentation. Then expose the chest. As you can see by the erythema or redness of the skin, the heat was effective at dilating blood vessels and increasing circulation to the chest. Remember from the physiologic response to a hydrotherapy video, just applying a fomentation or hot compress to the low back increased blood flow by 156%. Briskly rub the chest with the cold face cloth, paying special care not to vigorously go directly over the nipples. I like to have 2 face cloths dedicated to the cold basin, so that I can alternate between them while applying the cold friction. The purpose of the cold is to constrict the blood vessels, at least to some extent, acting as a cryothermal pump and increasing circulation locally, that is, to the chest and lungs. The cold brisk friction should last for about 30 seconds to 1 minute. Then when finished with the cold friction, thoroughly dry off the skin. Here I show a modification for female patients. You would do this maneuver for applying the cold and again with a dry hand towel to the chest to dry off. Ideally, you would have a female therapist working with a female patient. This helps everyone to be more comfortable. However, in this case, the patient here is my wife. Notice how I'm only leaving 1 layer as a barrier. This is because the patient said he could take it hotter, and he has no conditions that would make me concerned about his ability to sense temperature or thermoregulate. During this treatment, the patient will be sweating considerably. Therefore, it is important that you keep the patient well hydrated. Continue to exchange the cold cloth and wipe away the sweat from his face. This will make him more comfortable and able to do more exchanges. Strive to do at least 4 to 7 exchanges. Certain situations could benefit from more exchanges, while some individuals might prefer fewer initially. Always consult with a qualified healthcare professional who thoroughly understands the physiology of hydrotherapy before attempting more advanced hydro treatments, especially if one has underlying medical conditions.
After the last exchange, thoroughly dry off the patient's chest and arms. Then place a nice, fresh, cool cloth on the patient's head. Bring the ice basin down to the feet where we will pour the cold water over his feet, constricting the blood vessels and helping to prevent orthostatic hypotension when he rises. Ideally, you would have another draft-free location with dry sheets for the patient to rest for at least 20 minutes. And then dim the lights and allow him to rest.